Welcome to Let's Talk Learning Disabilities with Laurie Peterson. Laurie spends her days talking about dyslexia, dysgraphia, dyscalculia, and ADHD. She talks to students and adults who have had a lifetime of academic challenges. She's here to share their stories along with other insights with you. So let's talk learning disabilities.
Hey everybody, this is Laurie, and welcome to episode 113 of Let's Talk Learning Disabilities. I'm so glad you're here today, and I am super excited because we are going to talk about something that we have just never talked about before. I know we've got lots of questions about it, and we've had lots of interest in it, but we've never broached the topic. So today we're going to spend some time talking about autism evaluations, some symptoms of autism, and how autism, what its common comorbidities are, as far as like ADHD, learning disabilities, those kinds of things. So we're still going to bring it all back home to learning disabilities. But today I have a very special guest, Dr. Casey Vaccaro. She is a psychologist who specializes in autism evaluations. Casey, thank you for being here today.
Yeah, I'm so happy to be here. Thank you.
So can you just start out by telling us a little bit about you, how you landed, what you do, and who you work with?
Yeah, sure. So I currently work for Behavioral Innovations while also running my own private practice on the side, just doing therapy, counseling, consulting, mostly for families. I started off in the field doing predominantly forensic work with high conflict families. Most of the families that I had seen were dealing with kiddos that had really high behavioral needs, which led them to this place where there was abuse and neglect going on in the house. And I really started to fall for these kids in a way that I would have never imagined. I think I always saw myself navigating through the field for many more years before I found my niche. But I absolutely just loved it. Went into the school system for 3 years and worked at an alternative middle school where I got to spend time with kiddos who were on the spectrum, had any sort of developmental disabilities, and then also had any sort of behavioral diagnoses such as ODD. And felt like my goal was not just to work with individuals in the future, but I needed to work with families. It wasn't enough to just support the kiddo in school, but there needed to be parent training and there needed to be collaboration with the schools and pulling in community resources. I ended up moving to Texas. Soon after that, I've been here for 3 years and I love it.
Yay!
And I worked for a private practice clinic and I was their sole diagnosing provider for autism in Dallas and Austin. And now I have kind of transitioned to BI, really like it because I just get to work with these families one-on-one when their kids are so small and so young and figure out what are the next steps.
I love that.
Yeah.
I love that. So do you mind, and I don't know how easy or how hard this would be, but could you tell us, like, how would you define autism?
Yeah. So for the diagnosis of autism, what I'm really looking for is if these kiddos are coming in and they have social communication challenges that are really pervasive. Do they have difficulties understanding social interaction, social reciprocity, and really having back and forth? Or are they just socially withdrawn too? A lot of the kiddos that come in, they don't even really have interest in other kids their age, and that's something that I'm looking for. And that's usually one of the first signs that parents see. Another really big first sign that parents will come in with is that their kid is just having a speech delay or some sort of motor coordination challenge. And then there's also those repetitive and stereotyped interests that are going on. So maybe, the stereotyped ones are the flapping and the stimming, or their kid is walking in circles. But then there's also these like really perseverative interests where kiddos are so fixated on something and all they want to do is watch one particular show or play with one particular toy. And part of what's impacting them with play with other kids is that they don't want to play with other things. They only like what they like. And, God bless them for that because they can be all in for a really long time with that. But when it comes to anything else, it's really hard to transition.
They're really creative to it, bringing whatever the topic is back to that thing.
Yes.
Trains, dinosaurs, whatever, right?
It's amazing.
Yeah. So what about walking on toes? I know that's one I hear a lot too, like if they tend to walk on their toes.
It's something that happens. I mean, there's not really these clear definitions as to where autism comes from. And, we talk about it's, definitely a combination of genetic, environmental, neurological factors. The toe walking is just one of those pieces where, for whatever reason, as they develop,
it's part of their coordination or lack thereof.
Yeah, and it doesn't happen with all of the kiddos, but it is one of those common features that we see with that coordination piece going on.
But just because your child does that doesn't necessarily mean
No.
they're on the spectrum.
And we all have quirks.
Sure.
We all have quirks. And I think sometimes parents will really hyper-focus on that one symptom that they're seeing. The thing with autism is that it's a spectrum, and you have to fall on the spectrum. And there is going to need to be a cluster of those symptoms going on, and they have to have an intensity that really is clinically significant.
Now, I like that you said it falls on the spectrum, because there was, not that long ago, we talked about the different kind of levels of autism, and we talked a lot about kids that had Asperger's. Mm-hmm. Those are your high, everyone knows that's the high functioning autism.
Yeah.
So, but the DSM has, which is the Diagnostic and Statistic Manual, where kind of all these diagnoses are laid out. Then when they revised it this last, however long ago that was, they kind of did away with that, right?
Yes.
And now everybody falls just under that autism spectrum.
Yeah. I think it's more comprehensive the way they have it now.
Okay.
Having Asperger's was considered to be high functioning when really it was just high IQ. And I think that was the misunderstanding, where you can have a high IQ but not be functioning adaptively really well. Whereas now they put it into levels. So you can have a high IQ, but still there's level 1, 2, and 3. Level 1 requires support. Level 1 requires substantial support. And level 2 requires very substantial support. So they do vary. However, it's fluid. And I think that, it's broken up into different pieces of the diagnosis. So you can be level 1 when it comes to your perseverative interest, but level 2 when it comes to your social communication. And I think it just gives a better understanding of the severity in those areas. So now if there's a kiddo that has a high IQ and we put him at level 1, the school understands that, okay, level 2 actually refers to some of those social pieces, and he needs extra support in that area.
You're right. That absolutely does. So what's level 3?
Level 3 is just very substantial support. Those are the kiddos who probably need a one-to-one.
Like nonverbal,
More often than not. They're nonverbal. They're really struggling to communicate. They're having a lot of outward behaviors that require just frequent supervision, and maybe developmentally are also struggling.
And those kids probably get identified much earlier.
Absolutely.
Yeah. Okay, so can you talk about sort of what a standard autism evaluation looks like? What kinds of things are you doing with the child? What kinds of things are you evaluating, and who all's involved in that?
Yeah, so one of the biggest things, the parents are the expert in their kids. So there is so much clinical interview that happens, self-report scales that we are asking for. Parents are going to be filling out scales about behavior, scales about adaptive skills, scales about autism-specific symptoms and some of those quirks that they're seeing. And then they're going to come into the office, and I'm going to kind of go through it all again. And I'm really going to start probing for where I think there are, I'm going to go through all the questions anyway, but I'm going to start probing for where I think really stood out to me as I ran through those reports and those measures. The Autism Diagnostic Observation Schedule, the ADOS, is the absolute gold standard for testing. And that is something that kiddos at 12 months can start with, which is super little. Yeah. But again, if they're showing the signs, they could get that assessment. And then it goes through adulthood, which we do have adults sometimes, not necessarily at BI, but just in the world that want to get tested, and that ADOS can still help them get the information they need. The way that it works is you go through a bunch of different modules that just prompt for the different behaviors. So some of them are a little bit stressful for the children. Some of them work on transitions and just see how the child works through putting away certain toys, how they're interacting with the things that they are given. It's the same set of toys for kids at each age or each developmental level, regardless of where you are in the country. And there are definitely some specific things that you see where kids just will get fixated on, there's 15 toys in the room and they only want the little phone. Or they just repetitively click some of those buttons. And that's something that's diagnostic to me for sure. I get to look at some of the advances that they make socially. So are they going up to their parents and showing them anything? Or are they only going up to them if they want help with something and they need help opening something? Are they asking me to come sit with them? Or do they actually act like it's their world and we're all just living in it?
Right.
Which is really common, is that they just kind of navigate on their own wavelength. And then it's my choice on how I want to interact there.
So is there, as far as like the language component of that, when you're assessing, are you looking more like at that pragmatic language? Are you looking at expressive and receptive language? Like what language components do you typically sort of take into consideration through your assessment?
We're screening for all of it.
Okay.
For all of it, for sure. I want to see, how does the child make bids verbally or non-verbally to me? Are there gestures happening? So is the kid saying like, come here, or reaching versus pointing? And it comes down to things just like that. Because those are communication skills that are going to impact them all across. I mean, autism does not turn off if you go to school versus Target versus church.
Sure.
And just those little gestures, even for nonverbal kiddos, are important for me to see what their level of communication is. So many kids that I have come in now also have just like these little sign language ways of communicating also, which has really grown recently, and I think it's beautiful.
That's awesome. So when you make a diagnosis, first of all, if you say no to a diagnosis, is there something else that's usually going on, or is it just like, yes, you have it, no, you don't? Yeah.
So at BI specifically, what I'm working on is just letting the families know autism or not.
Right.
We have a limited amount of time, and we want to get the turnaround. Our turnaround's about 1 week for these feedback sessions. However, most of the time there's comorbidities going on, I would say. I mean, just ADHD alone is 30 to 50% of the time.
Wow.
For kiddos on the spectrum. So that's where they come to someone like you. We're going to want that IQ and that achievement testing, because we want them to have school accommodations if they need them, and make sure that they're starting off with intervention as early as possible. So I would say more often than not, I'm letting families know, hey, there's an additional evaluation needed for speech.
Right.
Or I want you to go for an evaluation to find out, what the academic functioning is going on here, what your child IQ is.
Yeah.
And that's really important.
Probably a lot of OT. Occupational therapy.
OT, speech, PT, all of those sensory processing challenges that we're seeing with the kiddos, where very similar to ADHD, but the sensory processing challenges that are going on, those need to be intervened with at an early age.
And I feel like with ADHD and autism, there is so much overlap.
So much, yeah.
I mean, I don't think people realize with ADHD, there is sensory type stuff going on there too.
Yeah.
And so loud noises or... Yeah, so there is so much overlap. And can you have both of them? Yeah.
Yeah, for sure.
Absolutely.
Yeah, and it's really common. I think the way that it manifests is different, and that's what I usually screen for, because I have parents so often, and some parents are just more resistant to being open to the idea of autism, where, they come in and they try to push for that ADHD. Like, do you think it's that? And what I really describe to them is, like, for example, the inattention piece. With ADHD, it's sustained attention. Like, can they sit and sustain attention? Versus with autism, it's more of the function of the behavior. Like, are they not attentive because they're just really not interested?
Yeah.
It's different. And the hyperactivity is like, is there excessive movement all the time, or is it when your kiddo's really excited or feeling that sensory overload and is frustrated? Those are big differences.
That is, yeah. And you're going to treat those differently.
Absolutely.
You're going to, and somebody with ADHD isn't going to probably respond to the same types of things somebody with autism would respond to in treatment.
Yeah.
Right?
Yeah.
At your school age kids, do you see a comorbidity of like learning disabilities very often? I don't know where that stands. I know a lot about ADHD and autism, but that's kind of where it ends.
Yeah. I mean, the learning disabilities for sure, because of that speech piece, I think that always, could come into play with the learning challenges. There's a pretty good mix, I would say, amongst the spectrum where some kiddos are average IQ, but then there's a good population that are below average IQ. And they're having intellectual disability, or they have just learning challenges that are there. And then there are the above average IQ that definitely stand out in a different way, but they also require testing.
Yeah. No, absolutely.
We need to know how they're going to learn best, too.
Absolutely. Do those kids that come in that might be struggling in school then, are they getting those are you able to provide accommodations based on your assessment for them?
Yes. So I will talk to families about what accommodations we think are the most valuable for their kiddo. Something that I think the schools don't always tell families that I love to kind of plug in is that you can meet with the school as often as you need to go over those accommodations. They love to hold those meetings once a year, and that is good and dandy if that's all your kid needs.
Right, and that's what the law says.
Yes, exactly. They have to. And I think public school does a really great job at following through and keeping the data as far as keeping up with the goals that your kid has. But meet with the school as much as you can, get those accommodations. I'm happy to sit, and I'm one of those people that over recommends because I tell families the school will probably give you about 70%.
Right.
So let's talk about what your child really needs and which ones we're going to fight for, because there are definitely the ones we want to fight for if we're advocating for our kids. And if you need an extra advocate, let's find one, and that's something I'll talk to families about too, is it's 6 versus 1 in that meeting sometimes. And we really want to make sure that we're going in and everyone has the kid's best interests at heart.
Do you know, is there, if you could like describe the perfect classroom setting for an autistic child, a learner, a grade school student, what would that look like for them?
I think typically more of the inclusion classes where it's a smaller class size. I don't want to give a number, but I do think that sometimes success ranges from about 6 to 12 and more teachers in the room, just more support. It decreases the sensory stimulation that's going on and some of that just distraction that could be happening in the classroom. And I think for the most part, kiddos on the spectrum need that more one-to-one, not one-to-one necessarily, but they need that more intensive care.
Do they need the structure, the predictability? Like, is that something,
Yes.
Do you want to teach them how to be okay with change, or do you want to set them up so that they always have the same exact thing?
So
It's kind of a double-edged sword, I feel like.
And you know what? It's something that I feel like I talk to families about is a family preference. Because some families love to be really structured and rigid, and that's fine. But I am definitely the psychologist that pushes for exposure. And I want these kiddos to be exposed to life. And I don't think that we can set up a perfect situation for them every day of their life. So I tell them, listen, once in a while, switch up bath time. Just tell them that you're going to be switching up bath time. I think as long as you prompt and you give time, they deserve to feel some of that discomfort once in a while. So as they grow up, they can cope with it.
Absolutely.
So I am all about exposure. And I know that some parents don't like to distress their kids in that way, but it really does pay off in the long run when they're adults and they can cope with change.
Absolutely. So Behavior Innovations also does a ton of ABA.
Yes.
Can you tell us a little bit about ABA?
Yeah. So ABA is a behavioral approach that uses positive reinforcement for modifying behavior in kiddos. So they're trying to increase those functional and adaptive behaviors while decreasing some of those more problem behaviors that are going on. It's evidence-based, and it is one of the few therapies, if not the only therapy, that is covered by medical insurance.
Oh, wow.
Yeah. So it allows for so much access for families.
Do you have to have an autism diagnosis to be able to benefit from ABA?
No.
I'm just thinking like positive reinforcement. Who wouldn't benefit from that, right?
Yeah, no, I mean, I absolutely, I have some kiddos that just have like a social pragmatic communication disorder. They would benefit from ABA for sure. Fetal alcohol syndrome benefits from ABA for sure.
ADHD kids?
ADHD kids absolutely benefit. I mean, if there are behaviors that parents and families would prefer to be adapted because it would be more functional for the kid, if we can give them services that make them happy, healthy, and well-adjusted, why not?
Right. And ABA would be appropriate up to what age?
I would say we have kiddos probably in the center that come into age 15.
Really?
12 to 15. However, it's also based on what, what the center can handle and what the need is of that kiddo.
What would a classroom of kiddos look like in the center? What kind of things are they doing to sort of promote that positive reinforcement and decrease some of those behaviors?
Yeah, so they are one-to-one at Behavioral Innovations.
Wow.
With their therapist, which is really great.
That's huge.
And just to kind of add it into, parents once a week are asked to sit down and have some sort of meeting with the therapist to generalize what they're learning throughout the week, which parent intervention is...
That's huge.
Yeah, absolutely. I mean, like I said, it goes across all settings. So the kiddos come in, we have a little playground area that really tries to generalize like a natural setting. And I think the whole day tries to mirror a natural setting that they would have going through school, trying to get through some academics, being on the playground, having that social interaction. And there is a lot of group social interaction that happens also, but it's just really heavily supervised and very well prompted, where these interactions are just very appropriate. And that's what we want these kids to see and to feel, and to also feel validated by other kids that struggle with the same thing. There's a lot of shaping that occurs, which is just getting the kid to break things down into very small, achievable steps, rather than looking at something as a whole. which makes them feel really successful rather than giving them a full task and then them feeling like they can't get there.
Overwhelmed.
Yeah, it creates these little, successful approximations, and as they get closer to the goal, they just keep getting reinforced the entire time. And that can be whether it is walking to the top of a slide and sliding down, or having a really great conversation and building those, just word to phrase conversation skills. They are going to be built upon with that therapist. I mean, some kiddos, they're sitting in the hallway and they won't get up.
Yeah.
And the second that they move a little bit, they're getting reinforced. And then the second they put one foot down flat, they get reinforced. And then they're standing, and all of a sudden it's not just the therapist, but the person behind the desk, the other therapists that are with other kiddos, everyone's cheering.
I love that.
And it is adorable. And then the kid lights up because they're like, holy smokes, I did something so great.
Everybody's cheering.
Yeah, and all I did was stand up, but they wanted me to do that, and that was awesome.
I just did what I was asked.
Yeah.
How often do kids usually come for therapy?
So 20 to 40 hours a week.
Wow.
At a young age. So if they are pretty young, they can use it as a replacement for school. Typically, I would say by around second grade, the school starts to push back and say, hey, we need them here more.
Yeah.
So there are programs, and we have a program that's called Beyond the Bell, where they can come in after school too, every day of the week if they want, and Saturdays if they want, and still have that group socialization with other kids. But the little guys, they're coming in every day.
That's a lot.
Yeah.
But insurance covers that.
Yes.
That is crazy to me.
It's awesome. It is so awesome.
That is crazy to me. So I think one question that I definitely have, back to the diagnosing.
Yeah.
If you don't mind.
Yeah.
What do you find? So we get a lot of parents that we test their kids and they're like, oh, I think they might be on, we get a lot of, I think they might be on the spectrum. Mm-hmm. What's the benefit to having that diagnosis at middle school age if you have ADHD or if you have dyslexia? What's the benefit?
The services that you're going to get are going to last so long.
Yeah.
First, early intervention is great, but even if your kid is in middle school, if you can now sit down with the school and find the way that your child learns best. School is not a one-size-fits-all. And I think they adapt it to this lovely general population that they would kill to have. But
and there's 3 of those kids.
Yeah, and who's learning that way all the time?
Yeah.
So I think that if you could get accommodations and you could modify the learning environment for your kid to meet the diagnosis that they have and to meet the needs that they have, and they could go out of the classroom and take a test, that's going to show their academic ability much more accurately than if they're sitting in a class trying to take a test and they're so overwhelmed and they're so distracted. And then it's just not an accurate representation of your kid.
Mm-mm. How much anxiety do you see alongside autism?
Yeah.
That's a big one.
It's there. Socially, for sure. And that's going to impact even just the willingness sometimes as they get older to engage. And with ADHD too. The anxiety just with those social interactions, both of them have so many challenges socially. They're different because with autism, it's more of I can't understand the social cues that someone's giving me. And I didn't realize that, this interaction was going differently than I thought. Whereas ADHD, it's I don't know how to hop into this conversation. And now I just interrupted someone and I'm going to stay really quiet because that was uncomfortable.
Right.
So they're different, but the anxiety is
still anxiety.
It's huge and it's so comorbid. And I think as kiddos get older, the best thing we can do is just make them feel so self-confident in their abilities.
Yeah, 100%.
That is so important. And it starts with the parents.
So I'm curious, as parents, you see a million, obviously your 10-day turnaround, you're seeing a lot of parents.
Yes.
Can you think of any autism myths that you tend to have to bust very often?
Oh, that's a super good question.
What are things that people come in and think they know about autism or think that they have nailed down and you're yeah, that's not really it. And there may not be any. I feel like there's a lot of really good information about autism out there.
Yeah, there is. And social media has made it more widely acceptable, which is the one thing I like about that piece. Yeah.
There's a downside.
There's a downside for sure. I have to think about that.
Yeah, and that's good. I love that there isn't one that pops in your head.
There's not this really strong one that comes through.
Are parents, do you find more and more parents, because of autism being more prevalent in social media and in the media period, that there are fewer parents that are I don't want that label, or are more accepting of the label?
I think there's fewer. Going back to the myths, I would say the biggest barrier that I try to break down with parents is that they waited until they were hopeless to come in for the evaluation. And now I'm at the feedback, and one of their biggest myths is my kid can never be in a relationship, my kid will never have a job, and my kid will just never be successful the way that I viewed them before they started growing up. Yeah. And that, to me, now that I think about it, is the biggest myth.
That makes total sense.
That I have to break down and say, hey, listen, we are here so young and so early. You know, we can't predict, but we can work really, really hard to get them as close as possible. And there is nothing to say that your kiddo on the spectrum cannot be in a relationship, have an amazing, successful job, and probably be more interested in that job if it's on one of those interests than I could ever even imagine.
Yeah, and be wildly successful.
Absolutely. So that is a myth, is that I think parents will come in and be really worried about their kid not being able to succeed in life because they have this label.
But I get that too. I mean, I get that you have this vision for your child, and now you've disrupted that, and they kind of go to the other extreme with it sometimes.
Yeah. And I think one of the things that I love to tell parents is, like, the world can benefit so much from having a mix of different minds. And kiddos on the spectrum, they do have different minds, but we need that.
Absolutely.
We need that so strongly.
They think outside the box for sure.
Yeah.
Okay, so if anyone is interested in more information about autism or about your center, how can they find you?
Yeah, BI keeps it really easy. Just go online, put in your zip code. I think at this point we have 91 centers between Texas, Oklahoma, and Colorado.
Holy cow.
So if there's not one, there might be one coming. But put in your zip code. There's going to be a form that pops up that says you can either apply to get an evaluation or just apply for ABA therapy. Put in your phone number, your name, and your information. Just consent to them reaching out to you, and someone's going to call you.
What's the wait time usually for, I know it's different at every center, but generally speaking, if someone's thinking about getting an evaluation, I know there are some myths about wait time right now.
Yeah, it varies. I would say for us specifically, 2 weeks.
That's not bad at all.
No, it's not bad.
6 months.
Yeah, no. It's not 6 months. They can get in. We have a couple of psychologists spread throughout, and, I'm working out of the Rowlett location, but we have someone in West Texas too, and then we have San Antonio and Houston and Austin. And like I said, Oklahoma, Colorado, like, there is someone that can help you pretty quickly.
That is awesome.
For sure. Yeah.
Well, thank you. Thank you for taking time out of your day to be here today.
This was so much fun.
This was huge. This is such great information. If you guys have any questions for me or for Casey, feel free to email me at letstalklearningdisabilities@gmail.com. If you have a friend or you know somebody who's been asking about autism, or it's been something that's come up in conversation, share this episode with them so that they can get a little bit more information. We are so thankful you guys have been here today. I hope everyone has a great day, and we'll see you guys back here next time. Thanks.
Thank you so much for joining us today. In our show notes, you can find information about today's talk, as well as links to resources and other episodes. If you have questions about today's talk, have ideas for future episodes, or just want to stay connected, you can contact us through Diagnostic Learning Services on Facebook, Twitter, LinkedIn, and Instagram. So, let's keep talking learning disabilities. This podcast is sponsored by eDiagnostic Learning. You can find more information at www.ediagnosticlearning.com.